What if I told you that diagnosis doesn't matter? I know it sounds crazy, but in a world that craves labels, diagnosis is not always the first step to healing. Many of us find security in labels because it's a defined explanation of what ails us. But today I'm going to explain to you why that doesn't always help, and sometimes it actually interferes with the healing process. And when we address emotional well-being along with physical things like food and supplements, that's when really true healing comes in. So let's rethink beyond diagnosis, where real healing begins. Welcome back to the Good Gut Feeling podcast, where we digest modern medicine with old world wisdom. This is Dr. Alexandra Shestina, your host for today's podcast. And today, I'm really excited to talk about beyond diagnosis. It's really something that I speak to patients about every single day. But yet, most people still are looking for a label. And many of us find security in a name. People come to me, I just don't know what it is. Can you just tell me? Or all these doctors tell me I'm fine, but I feel terrible because they're not able to give it a label. So I'm going to tell you something. If you feel terrible, if you don't feel yourself, if you feel like your digestion's not working, but everyone's telling you you're fine because you don't have a label, that's not the truth. But if you have a label, it doesn't mean that your healing journey is going to be the same as everyone else who has that label. So welcome to today's episode of Beyond Diagnosis. Many of us find security in labels because it's a defined explanation of what ails us. But today I'm going to explain to you why that doesn't always help, and sometimes it actually interferes with the healing process. Why is that? Because let's talk about labels for a second. Let's talk about what labels mean in healing. Let's talk about what labels mean in medicine. Why do we even need diagnosis? In traditional models, the diagnostic system does not exist. Not like it does in the Western medicine model. When a patient comes to us, we get some information that they tell us. The second step is a physical examination. Then we make an assessment and a plan. The plan may require further testing in order for us to get a diagnosis. But why do we need a diagnosis? For a number of reasons. Number one, it allows doctors to communicate. Because if I say you have this condition, it's easier for someone to get a grasp on it. Number two, it expedites billing, and it allows for a model where we need a diagnosis to order a test to work. For example, for your insurance to pay for a certain test, they need a certain diagnosis. And this is the model that has been established in this type of structure. But in traditional models, like traditional Chinese medicine, they don't have a diagnostic system like this where someone gets a name. You will never hear a traditional Chinese medicine doctor who was traditionally trained to say that you have disease X, Crohn's disease, heart disease. They will say there's a deficiency in some kind of energy. There's an imbalance in some kind of energy. And that's always unique. And that's always specific to that person because the pattern of imbalance is always specific. It's always unique to that person's life, root causes, composition, genetics, and more. So no one looks exactly the same from a traditional model because you are different from everyone else. But in the Western medicine model, we have a language. That language is diagnosis. That language is transcribed into numbers, into codes, and those codes allow for billing. But I'm going to explain why sticking a label may do more harm than good. Many patients identify with their diagnosis. You may have heard people say, I'm a Crohn's patient, I'm a cancer patient, God forbid. And then that identity sticks with them, rather than having a condition that is separate from them, or rather not even having a condition, having an imbalance that causes certain symptoms. Now, the more we can separate our identity from our diagnosis, the easier it is to heal, because I am not my disease. I am a healthy person who has an imbalance. And once that imbalance is corrected, the disease doesn't exist. So the number one problem with creating labels is the identity to that label. The second problem is that it actually doesn't give us true clarity. You take two people with the same diagnostic condition, but for one of them, a certain medication might work, but for a second one, it doesn't work. And for a third one, it causes an adverse effect they don't tolerate. So it's not the same condition, right? Because if the protocol is for condition A, I provide treatment C, but treatment C doesn't work for everyone else with condition A, then the condition A is not consistent. Then it's not the same condition. Then there's variations in that condition. So therefore, the diagnosis is too broad to cover everyone. Think about a condition like IBS. Many of you may have been diagnosed with it, but it's very, very variable. Some people have diarrhea. Some people have constipation. Some people have different levels of discomfort or pain. Some people have it very severe. Some people have it very mild. First of all, the symptoms are very broad, but even more important is the root cause. The root causes are always unique. So for example, for many people, IBS is related to some kind of mind-body connection, but everyone's experience is different. So for some people, it might be work stress. For some people, it might be childhood traumas. For some people, it might be loneliness. So even just that is so unique to each person. And treating everyone with the same label, the same way is not effective. And we are not effective in treating chronic disease as a medical community, because if you look, we haven't cured a single chronic disease. Chronic disease is on the rise, and the use of medications is on the rise. The journey beyond symptoms is really where healing begins, because symptoms are really just the final manifestation of a root cause problem. And it happens in a certain way based on genetics. Because what is genetics? Genetics is our predisposition. So if some person may have a weakness that manifests in the form of allergies when there is an environmental trigger. And for some people, it's autoimmune disease, and for some people, it's a heart condition. But those genetics cause predispositions. They may even cause weaknesses, but they don't cause diseases for the most part, unless there is an environmental trigger. There's very few true genetic diseases. So when we have an environmental trigger, whether it's emotional stressor, poor food intake, inadequate sleep, any of those things are going to hit us in different places based on our genetics. Because for some people, their weakness is in one place, and another person, their weakness is another place. And the stressor, whether it's physical or emotional or energetic or food, is going to hit us in that weak place. So the manifestation is going to be based on our unique weakness. That doesn't have to manifest if we optimize our life. But we're not perfect. The world's not perfect. So the outer manifestation does not talk about the root cause. If we're just focusing on symptoms, we never get to the root cause. This is when we have to try to dive truly deep into a person's lifestyle, history, childhood, social interactions, and more in order to really understand what is the root cause. And the root cause is specific. And there are people who have things in common. That's of course true. But the pattern, that's uniquely yours. And if we don't get to that point where we understand exactly where you're coming from, and we just give you a label based on external features, we will never get to the root cause. And that is the danger of the one-size-fits-all system. Remember, one size doesn't fit all. We need to embrace our unique healing journey. You've seen some people with a very common condition like high blood pressure. For some people, it's really just managing their diet because they're eating the wrong things that are causing inflammation. And for some people, maybe they do need a medicine. And others can do well with herbs, and others can do well with supplements. But even the supplements, to give a supplement for a diagnosis that's based on external symptoms doesn't work. We have to get to the root cause. The root cause is necessary even to choose the right pharmaceuticals, because any doctor will tell you, yes, we have certain protocols and we have certain guidelines. They never work for everyone, because there's always going to be people outside of the bell curve who some are not going to have benefits and some who are going to have adverse effects. And you hope that the majority have more benefit. But what if we could take the time to dive deep and really understand what that person needs, so we don't have to guess? So we don't just have to say, well, it worked for 5 people, maybe it's going to work for you based on external thing. We can just actually learn about the specific needs of the person, the specific unique life that they're living, where they're living, what climate, what environment, who's their family, what are they eating. And when we can get to know that, we can really create a personalized plan, because it's really personalized medicine that gets to the root that really creates true healing. Healing isn't isolated, it's interconnected. And here's why. For almost everyone who I have seen in my practice, they need an approach that involves multiple factors. So that it involves stress management, it involves emotional healing, it involves nutrition, it involves supplements. Because when we take an individual as a whole from a holistic perspective, rather than the fragmented perspective that we've seen so much, when we start looking at a person as a whole, they're multidimensional. They have different parts. And when we create a program that has an interplay of all those parts, the right nutritional plan, the right mindset plan, the right lifestyle plan that is uniquely theirs, that really creates true healing. It's a combination. And that combination is very hard to do for a group. That can only be done for an individual. And this is where personalized precision medicine is key in true healing, in creating the right combination for someone's healing journey. I've seen patients with severe symptoms of ulcerative colitis who did extremely well by really being strict and changing their diet. And then I've seen patients who were already on a very clean diet with the same diagnosis and it wasn't working. So what do you do? This is where the interconnection comes in. We're approaching each individual with different modalities, with different changes, and addressing their unique needs that creates true healing at the root cause. When we view through this integrative lens, this facilitates a deeper understanding of what the person really needs. An understanding that can only be done on an N of 1. Can't look at 50 people, 100 people, 1,000 people. We look at one person and only what works for that individual. And when we address emotional well-being along with physical things like food and supplements, that's when really true healing comes in. So let's rethink beyond diagnosis, where real healing begins. So don't think of yourself as an ex-patient or I have this disease, or even that it's a part of me, or that I'm part of a group that has all the same symptoms and therefore we're all the same and needed to be treated the same. It doesn't work like that. You are a person with your own balance and imbalance in different places, with your own unique nutritional needs, with your own unique lifestyle, with your own unique history, with your own unique childhood. That was specifically for you. You don't look like anyone else, and you are not like anyone else. And whatever challenges you have, they're for you. And those challenges have a unique protocol. That protocol is different from your friend's protocol and even your family member's protocol. And although people within families, perhaps, who share genetics may have some interplay, they may have some commonalities, they're still different. And every person needs to be addressed differently. And I'll tell you, in my practice, I even speak to every person differently, explaining things that I do every day in different ways, because I know one person is going to understand it in one way and another person's not going to appreciate it in that same way. They need to hear it in a way that works specifically for them. Embrace a health path that considers your unique needs, transcending diagnosis to achieve true well-being. Thank you for listening. If you like what you've heard, please subscribe, share with your friends. If you like what you've heard, we have so much more on wholegut.com. I look forward to seeing you all next week.